Mr. Stinson. How are you doing today? My name's Bailey. I'm going to be your nurse. I'll be taking care of you for the day. Entering the room, I'm going to go ahead and wash my hands, perform hand hygiene. I'm going to complete the QSIN, make sure that the whiteboard on the wall is updated with the patient's name, the correct date, and my name as his nurse. I'm going to go ahead and make sure that the correct amount of side rails are up for safety. I'm going to make sure that he has his call light. And then I'm going to go ahead and assess for any drains or tubes, which he does not have. I'm going to go ahead and make sure there's no clutter in the room that anyone could get tripped up on. I'm going to make sure that he has his water pitcher near, he has a trash can near, and that his bed alarm is on for safety. Okay, Mr. Stinson, I'm going to go ahead and start your head to toe assessment here. I'm just going to check you out and assess what's going on. So you came in to the ER because you were complaining of nausea, vomiting, and severe itching. Okay, well, I'm going to check you out and see what's going on here, okay? First, I'm going to start with getting a temperature under his tongue. Okay, I'm going to go ahead and get his pulse here. Okay, 102, so that's a little elevated. I'm going to go ahead and get his blood pressure. Okay, that is 153/97, so that is slightly elevated as well. I'm going to go ahead and watch your respirations here. Just breathe normally. Okay, 24, so those are also slightly elevated. And I'm just going to go ahead and check your oxygen level. Put this sensor on your finger here. That is 90. Can you tell me where you are? Okay, and your name and date of birth? Okay, and do you know what year it is? Okay, I'm going to go ahead and check your pupils here. I'm just going to open this eye. Okay, and this one? Okay, they are round, reactive, equal, and they're about 3 millimeters. I'm just going to listen to your lungs. Just go ahead and take a deep breath for me every time I lay this stethoscope on your chest, okay? Warm it up for you so it's not cold. So under your arm here. Under this arm as well. And I'm going to go ahead and check for dehydration here. Just going to pull the skin up, make sure that there's no tenting. Okay, and can you go ahead and turn your head that way for me? Okay, and go ahead and turn this way, just checking for JVD. Okay, I'm going to listen to your back here. Same thing, deep breaths. Okay, you've got some slight crackles in the lungs, and you say you're feeling a little short of breath. Okay, I'm going to go ahead and listen to your stomach here, okay? Okay, you've got bounce sounds in all 4 quadrants. I'm going to go ahead and feel. Let me know if anything's tender or you have any pain, okay? And when was your last bowel movement? Okay. I'm going to listen to the apical heart rate for 1 minute. Okay. And do you have a productive cough? And are you passing gas? And is there any frequency or burning when you pee? His abdomen is soft and rounded. There's no distension. I'm going to go ahead and feel the skin here. It's a little pale. He definitely has some pitting edema in his arms, probably 2+. Can you go ahead and squeeze my fingers? Okay, and go ahead and push and pull. Are you experiencing any numbness or tingling in your hands or pain? Okay. No pain in your hands, that's good. Can you wiggle all your fingers for me? Okay, can you tell me what finger I'm holding over here? Good, and what finger I'm holding over here? Good, and then I'm going to go ahead and check cap refill on all 10 of your fingers. Make sure that that's less than 3 seconds. Your chest is symmetrical, but you are breathing a little heavy. I'm going to go ahead and make sure your pulses are even on both sides. Okay, I'm going to go ahead and move down to your legs here. You definitely have some 2+ pitting edema in your legs as well. Go ahead and push against my hands here. Okay, and pull your toes up. Good. Can you wiggle all your toes for me? What about numbness or tingling in your feet? Are you experiencing any of that? No? Okay, that's good. Can you tell me what toe I'm holding right here? Okay, and what toe over here? Okay, I'm going to go ahead and check your pedal pulses here. Make sure they're present. Yes. Okay, I'm going to check cap refill on all of your feet, all of your toes. Okay. You said you missed dialysis yesterday because you weren't feeling well? Okay, well, I'm going to go have a chat with the doctor and see what he thinks and probably be back with a few medications for you, okay? Okay, Mr. Stinson has returned from hemodialysis. They were able to pull fluid off of him and he tolerated the procedure well. The healthcare provider prescribed you Epigen, 2,000 units sub-Q once. So what that is that treats anemia, so your red blood cells were low, and that could be due to dialysis. A lot of people on dialysis take this medications. So with this, you just want to watch for a headache, body aches, cough. Your injection site may be sore. It may cause a little bit of increased blood pressure, so we're just going to go ahead and monitor that after I do administer the medication. I'm going to go ahead and wash my hands here. I'm going to put my gloves back on. Mr. Stinson, can you tell me your name and date of birth? Okay, I'm just going to go ahead and check your bracelet, make sure it matches with my bar here. Okay, and do you have any allergies at all to this medication that you know of? No? Okay. Bless me. Excuse me. Oh, jeez. Okay, so like I said, this medication is an injection. I'm going to give it to you in your stomach here. And before I give the injection, I'm just going to make sure that I have the right patient, which I checked the armband and his date of birth matching the MAR. I'm going to make sure I have the right drug. So I'm going to check and make sure I have Epigen, 2,000 units. I'm going to make sure it's the right route, which is sub-Q, so that is an injection. I'm going to make sure I have the right amount, which is 2,000 units, drawn up here in this syringe. And then I'm going to make sure it's the right time. So it is once once daily after he returns from dialysis. So, I checked everything I need to before I give this medication here. I'm going to go ahead and cleanse the area with an alcohol swab about 2 inches. I'm going to go ahead and remove that alcohol swab, let that dry. I'm going to hold his stomach here. I'm going to insert, and I'm going to hold the needle. I'm going to go ahead and insert the injection, and I'm going to pull the needle out in the same angle that it was put in. I'm not going to recap the needle. I'm just going to go ahead and throw this away in the sharps. And then I'm going to document the drug that was administered, the route it was administered, how much was administered, the time that it was administered, and how the patient handled it. So I'm going to go ahead and document that. Take my gloves off here, perform hand hygiene. Okay, Mr. Stinson, I'll be back, okay? Okay, so some teaching from Mr. Stinson here. Mr. Stinson, I'm going to advise you that you don't miss dialysis. It is very important to get all that excess fluid off of you since your kidneys do not filter it. When the excess fluid does sit on you, you end up getting edema in your legs. It could settle in your lungs. That could be why you had some crackles in there earlier. If you aren't feeling well, just go ahead and call the hemodialysis center and see what they advise you to do, okay? So I'm just going to report off to your next nurse here. Okay. So Mr. Stinson is a 52-year-old male with a history of hypertension, diabetes, mellitus type 2, chronic kidney disease, and chronic heart failure. He came into the emergency room complaining of severe itching, nausea, and vomiting. He appeared pale and pretty lethargic. He reported some shortness of breath, and during his head to toe, there were some crackles in his lungs. He was admitted to our unit and then transferred down for a dialysis treatment that he had skipped out on. His B1 and creatinine were increased, and that could be due to the kidney function. His BNP levels were also elevated, and that could be due to the chronic heart failure. His glucose was elevated, and then his potassium was also elevated, probably due to the decreased kidney function. So following dialysis, Mr. Stinson did get an injection of Epigen, 2,000 units in his abdomen. That is documented. And following dialysis, he also got vital signs, and he got weighed. Okay, Mr. Stinson, I hope you get better. Thank you.